In this video, we are going to talk about the red flags of headaches. Red flags means that we should take this thing seriously because if missed, it could lead to a catastrophic outcome. It is recommended to see your doctor right away if you have any of these red flags coupled with headaches. But before anything else, I would like to introduce myself. My name is Dr. Bumatayo. I am fondly called Dr. Boom by my patients. I am an internal medicine doctor and a practicing hospitalist, which is a doctor who takes care of admitted patients in the hospital. Since this video deals with the red flags of headache, it is important to review what causes headache. This is a picture of the head which shows the inside structures. So basically, any structures here affected by any disease will cause headaches, from the scalp to the bones, to the covering of the brain, blood vessels, the brain itself, or sinuses can lead to headaches. So let's start with our first red flag, fever. While it is true that fever can cause headache, but in this particular red flag, the headache is much different than those types of headaches that you might have had before. What is worrisome is, along with fever, the headache now comes with neck pains. If your doctor is suspecting an infection that is affecting your brain or the covering of the brain, which is called meningitis, a lumbar puncture is performed right away. This is a picture of a patient undergoing a lumbar puncture. As shown in this picture, the doctor will insert a needle in your back to obtain a fluid sample coming from your brain to see if there's an infection. Antibiotics should be started right away if there is a suspicion for an infection. Red flag number 2, pattern changes. Say a patient have had headaches for a while. That patient know certain patterns with regards to his or her headaches. Say it's usually on the front, starts in the afternoon, but now the headaches are presenting in a different pattern. The location is different, triggers are different. This could be a sign that something serious may be going on. There may be something that may be causing the pressure from inside the head to increase. Same with red flag number 3, which is the headaches that worsens with positional changes. Also with the red flag number 4, headaches that occurs during activity. This may be the earliest sign of some tumor inside the patient's head. Now this particular red flag is a clinical sign, meaning that the doctor now confirms that something is definitely causing an increased pressure inside the patient's brain. The doctor, through an instrument called ophthalmoscope, is able to see through the inside of the patient's eyes. This is a normal fundoscopic appearance. As you can see, this is the optic nerve and it has a distinct margin. You can see that the blood vessels of the eye converge into the center of the optic nerve. A patient with optic nerve swelling or papilledema will lose the margin of the nerve. A patient's vision at this time may be affected. This is highly suggestive of a brain tumor or something that affects the integrity of the brain circulation or draining system. The next red flag is a headache which is progressively worsening. As previously discussed, this may be suggestive of an increased brain pressure or glaucoma, which we will discuss later. The next red flag is pregnancy. So headaches in pregnancy can suggest that this particular patient's blood pressure is poorly controlled. A pregnant patient who has had new onset headaches needs to be evaluated by a doctor right away. There is a condition called preeclampsia, which can lead to seizures and compromise the child in her womb. The next one is eye pain, which is suggestive of glaucoma. This refers to an increased pressure in the eyes that can lead to blindness. One type of glaucoma is a medical emergency and needs to be dealt with right away. Another red flag is that one that occurs after trauma. In this particular picture, you can see a white appearance here and here, which denotes a new blood that has been formed inside the brain. This is called subdural hematoma, and this one is called epidural hematoma. Now, these are just names that tell us where the blood is located with respect to the brain covering. These are medical emergencies as the blood can put a lot of pressure on the patient's brain, and this blood needs to be drained right away by a neurosurgeon. The next one is patient with compromised or weak immune system. These are the people who are having active chemotherapy or those taking steroids. These patients' bodies sometimes cannot mount any defense from an infection. They will not present with fever. Most present with fatigue, lethargy. Headaches can suggest an infection in the brain or sinuses. Lastly, age. Patients above 50 with worsening headaches, accompanied by tenderness at the temple with or without bulging of the veins at the side of their head like the one in this picture. Presenting with some blurred vision, they may be having temporal arteritis. This is diagnosed by biopsy of the vein, or vessels at the side of the head. If these remain untreated, this can lead to blindness. So in summary, this is the list of the red flags for headaches. If you have any of these signs, symptoms, and conditions, it is better to consult your doctor right away. Thank you very much for viewing this video. I hope that you can watch my next video. Don't forget to subscribe to this channel and click the like button. May you have a good day. God bless.